So this information on stewardship is very important for how we measure judicious use of antimicrobials, how they're used, who makes decisions about use on farms and on feedlots, and especially as we move forward after the FDA changes of January of 2017, we'll want to know how feedlots are accessing and recording and using antimicrobials. This is important information. And so, as I note here, most of these questions are self-explanatory. If you read through them, we want answers 1x per row, as in, say, question 1A, whether or not the information is recorded. We're not, in question 1A, for example, it says date treated. This isn't a question about asking for the date treated. We're asking about frequency of recording. So starting with question 1, we ask how frequently was the following information recorded when they were treated as a group. And again, that's the injectable antibiotic for metaphylaxis. And here we ask never, sometimes, most of the time, or always on record keeping. And whether it's the date, the antibiotic given, or the treatment withdrawal period. We're looking for that record keeping information. On question 2, were any of the animals or any of the individual steers and heifers that became sick treated with antibiotics? And if they were not, then you can skip to question 4, and we ask the same type of questions. How frequently was the information recorded for individual sick animals treated with injectable antibiotics? Okay, and then so we move on to question 4. Were cattle given antibiotics in feed? And here, if they answer no, you can skip to question 6. Moving on to page 11, again, we're looking for frequency of recording information for antibiotics used in feed. And again, we're looking for basically 1x per row. But in this one, on question 5A, we would like you to record not the date that use began, but whether they recorded that information. So do they record the date the antibiotic use began? Do they record the date the antibiotic use ended? Do they record the antibiotic used and the withdrawal period? So I think that's pretty self-explanatory. Going on to question 6, we have the same process for antibiotics given in water. Were any of the steers and heifers given antibiotics in water? If not, then you can skip to question 8. And again, this is the same kind of questions that we have above. Did they record the date the antibiotic use began? Did they record the antibiotic use ended? Did they record the antibiotics used and a withdrawal period? So those, I think, are pretty self-explanatory. If anybody has questions, I'll give you wait a few seconds to see if we have any questions on that. Okay, so we are moving on to the quality assurance program, and the beef quality assurance program is something that can be part of the National Cattlemen's Beef Association or the Texas Cattle Feeders Association or maybe something else in the state. And we're asking if the producer is familiar with the BQA program in the state, and check only one box if they're very familiar, down through not familiar at all. So very familiar, we have some definitions in the manual on page 71. Very familiar means they're fairly knowledgeable. Somewhat familiar is that they know some basics. Heard of in name only, but not much else, or not familiar that they've never heard of it before. Okay, so the training, we're asking about in the previous 5 years. Has a producer or someone representing the feedlot attended a national, state, or local BQA meeting or training? And that's, I think, pretty self-explanatory as well. It's a simple yes/no question. And on question 10, we have a question about participating in a BQA Feedyard Assessment within the previous 5 years. And for those producers who may not have information on this, on page 71 in the manual, we describe the Feedyard assessment tool in the manual. It has 3 areas. It focuses on animals, records, and protocols, facilities, and equipment. We note that it can be performed as a self-assessment or by a second party or a third-party assessor. So if you need more information on the Feedyard assessment or anything to do with the beef quality assurance program, to go ahead and access the website and hopefully be able to find the information there. Okay, I'm going to move on to the VCPR question, and this is question 12. And it is, okay, question 12 is on page 12, and we are on use of veterinarians overall. So the familiarity with the veterinarian-client-patient relationship is very important in the FDA, in the new FDA guidances. So in the manual, we've actually, further down, you'll see that there is a definition by the FDA for a VCPR. On the right on this slide, you can see that AVMA also has a definition for a VCPR, and states might actually have their own definitions in their State Practice Act, because there is a requirement, a prescribing requirement, that you must have a relationship between the veterinarian, the client, and the patient in order to prescribe drugs. That is part of the Practice Act for most states. And so the first question we have is, again, familiarity. Is the producer familiar with the VCPR? We will, further down, we will have questions specifically regarding the VCPR, but this one is just their familiarity with it. So question 13 is related to use of a veterinarian in 2016, and that is, did the feedlot use the services of a veterinarian? And if they respond yes, then skip to question 15. If they respond no, then you'd want to go to question 14. For those operations that didn't use a veterinarian in 2016, which was the primary reason, check only one, for not using a veterinarian. And we have a list of 4 that we define there, and then an other, so that for those who don't find their option on the list, if you could just write that in, that would be great. We want as much information on veterinary use as we can get. Okay, question 15. We're looking at the types of veterinarians that were used in 2016, and the options are whether they have a full-time veterinarian on staff, which might be the owner of the operation, if the owner is a veterinarian, whether they use a private veterinary clinic with the veterinarians making regular or routine visits, or a private practice as needed, and that would be as they're called in. Okay, moving on to question 16 then, is the number of times the feedlot was visited by a veterinarian in 2016, and that's related to the feedlot operation, recording the number of visits. Okay, so we're going back then to the VCPR information, and here we have some definitions for it. So we are on the manual, in the manual on page 73, and again we're close to the bottom of page 12 in the questionnaire. And here we ask, do you have a VCPR with a veterinarian or a veterinary clinic for this feedlot? And the definition of a VCPR is in the manual, and it was, again, in the previous slide, the AVMA definition, but the FDA definition is in the manual in case the producer wants to know more about what is a VCPR. There are specific guidelines for what a VCPR is, and that is about assuming responsibility for making medical judgments. The veterinarian has to have sufficient knowledge of the operation and the animals to make a diagnosis of the medical condition, and the veterinarian is available to follow up in case of adverse reactions or other or failure of therapy. And so these are fairly strong guidelines because we know in the past there's been significant over-the-counter use of antimicrobials. As we move forward with the FDA guidance changes, they will be required to have a VCPR and in some cases actually have something signed so that there is a document on file, either at the lot, the feedlot, or with the veterinarian, and then the state might have guidelines for how long that VCPR, the record has to be in place and recoverable in case there's an audit. And so question 17 specifically says, do you have a VCPR? And if they say no, then you can skip to question 19. But question 18 would be how you a description of the producer's VCPR. And as I said, that there is some states require a written document signed. Some just state they have a verbal agreement, and some say they mentioned it, but it's informal. And I think what we'll find is this will change over the years as the FDA guidance goes into effect. So I'm going to pause here for a few seconds and see if anyone has any questions about the VCPR information and where to get more information on that. Okay, so hearing none, we'll move on to question 19, and this is about antibiotic use practices, how they obtained medicated feed to be fed on the feedlot. And so 19A, specifically, if you look at this, it says that no medicated feed was fed to cattle on the feedlot. That's a yes, no, or don't know. But if question A, 19A is yes, then they have said no medicated feed, and you can skip to question 20. If 19A is no, then you want to continue and look at 19B, C, and D. And these are referencing type A medicated articles and type B or C medicated feeds. And so you'll see in the manual, these are defined. And we'll go over them just briefly, but a type A medicated article is the most concentrated form of a medicated feed additive. It's not fed directly to animals. It can be used to make another type A medicated article or type B or C medicated feed. So this is the most concentrated, and it's never fed directly to animals without mixing. Moving on, type B medicated feed is used to make another type B or a type C medicated feed. A type B medicated feed is never fed directly to animals without further mixing because although it's less concentrated than type A, it is more concentrated than a type C medicated feed. We have some notes in the manual about the labeling on this that says for further manufacture and do not feed undiluted. So most of the producers, I think, will understand the difference between these different types of medicated articles and feeds and be able to answer these questions. And then type C is the least concentrated. It can be fed without further mixing. types are fed is a full ration, a top dress, or fed food choice. So if there are any questions on that, on the type A medicated articles, type B and C medicated feeds, we recommend that you can look these up online in the FDA website. I think has pretty good descriptions as well. They tend to be pretty complex though, and I know that when we've presented with the FDA at some meetings on the changes that they're to the guidances that were going into effect on January 1st, that producers had a lot of questions on the medicated articles and feeds and how they would be affected by the veterinary feed directive changes and so forth. Okay, so moving on to questions.
Yeah, this is Tom Brignoli here. I'm sorry, I got a question. I'm not sure I understand the difference between 19B, as in boy, and 19D when you're talking about type C medicated feed that doesn't have to be fed with any further mixing.
Type D, Part D, that's where they do mixing on the farm. B is where the feed is delivered ready to be fed by a mill.
Okay. Okay, so, okay.
Good question.
Is there a definition of type A, B, and C somewhere?
Yeah, they're in the manual.
They're in the manual. Where? Oh, they're in
73.
But in other words, C and D are going to be answered yes if they're further mixed on the lot.
So I think maybe could you restate that? I think we didn't hear it. We were responding to a question online. I think your question was about, well, go ahead, Tom.
Yeah, okay, so if I understand from the explanation there, 19C or 19D, as in dog, would be yes if the medicated whatever, be it a medicated, a straight medication or a medicated feed supplement, would be brought in and further mixed on the property.
Correct.
Okay. Okay, I think I get it now. Thank you.
Yeah, this this actually was, as I said, in the listening sessions when the FDA went around the country and talked with producers. I would say that type A medicated article, type B, type C really raised a number of questions that were more elaborate than we have covered here in this questionnaire. And this was something that required a little more context, I think, for some of the producers. So the questions on the definitions are on page 73, at the bottom of page 73, top of 74 in the manual for anyone who doesn't have their manual on hand right now. You can go back and reference it there. Okay, good question. Thank you, Tom. Moving on to question 20. Did the producer purchase bagged medicated feed from a farm or ranch store in 2016? We're interested in knowing the percent of producers who purchased with medicated feed prior to the FDA rules going into effect in 2017. One of the things that and you'll see this in the manual, we are not interested in learning if there was stockpiling. We're not trying to get that degree of information from the producer. But we did hear from some folks that that producers might have been stocking up and that they might be sensitive to these questions. So again, we will not release any of their identities beyond data collectors, obviously, and so that this is protected information. We know that many of the farm and ranch stores stopped selling medicated feed on December 31st of 2016. So this could be a sensitive question. Question about decision making, about the use of antibiotics on the operation. And I believe it starts with question 20. This covers question 21 or 22. Question 21 on page 13 is for antibiotics in feed. Question 22 is for antibiotics in water. And you'll see a box that says check all that apply. So if you select box 1, that would state there were no antibiotics used in feed on the operation, or there were no antibiotics used in water on the operation. And so, if they aren't using any antibiotics, we certainly want to know that, and then check if someone did use them, the owner, the farm manager on site, a veterinarian, private veterinarian, other veterinarian, or nutritionist, or service manager. So we have a number of choices to select who made the decision about the use of antibiotics in feed or water. So we have a note that this is related to protocols for antibiotic use. So if they do have protocols for antibiotic use, you might ask them to reference that and see if you can glean the information from there. Okay. Questions 23. This is regarding injections. Injectable antibiotics for group treatment. And we have, again, that group treatment means at least 90% of the cattle in a pen are treated. So box 1, again, is antibiotics for not used. Or you can check all that apply, which is similar to the list on the previous slide. And we're looking for information on who decided whether antibiotics should be used. Then question 24, injection or bolus of treatment for individual cattle. So question 23 is for group, and question 24 is for individual treatment. Okay, so this brings us to the end of the antimicrobial use portion of the survey. And we do have the office use questions, section D. You've probably all done these before. Again, you have the state zip code, the operation number from the NAHMS survey, the NAHMS consent form, and then the rest of the questions are those that you've probably completed before: the time for interviewing, the time for travel, how to identify the data collector, what role did they play, and a response code. We did ask about respondents' position in this operation. This will be a little bit different in the swine survey. If you're joining us on Thursday morning, we'll also be asking these types of questions a little bit more elaborately during the swine survey. And the producer data quality, this is one that I think is a subjective response that you can complete. Chuck, did you want to say anything about this in the past, how you guys have collected producer data quality, a sense of what data were handed to you as the survey, as the surveyor versus the participant, or anything?
Yeah, it just gives us an idea of the quality of the data, whether they seem to guess at everything, or whether they use records, or whether they, even if they didn't consult records, whether they seem knowledgeable about their answers.
Okay. And then finally, on question 7, if you could add any further comments that you would like to, and then sign. Okay, so this is the end of the questionnaire, and we still have time for further questions, if anyone has any. I do have in the slides places you can go for further information, and just on the horizon, I do want to talk a little bit about what we might be doing with these studies. We might be repeating these studies in FY19. We don't have funding and plans to do this in FY18, so we've been talking about doing these in FY19 again every 2 years. We've also received funding to do what we call longitudinal studies, so if people have questions about those, there's a little information here. Some folks might actually have heard that we're doing these, and here's a little bit of information on them. These are long-term studies, 3 to 5 years. But when we do these studies, it won't just be surveying. We'll actually be doing biological sampling. So we'll be collecting survey data similar to the NAHMS surveys, and then the samples. Right now, the plans are tentative, but we do expect to collect samples for foodborne pathogens and animal health. The data will be collected confidentially and protected, but as Bill said, we cannot ask VS people to see animals, so we have to work on how we can collect data confidentially and protect the information while we also protect the producers. And then we might be enrolling as early as 2018, so if you have any producers that are extremely interested in this, please keep in touch with them, I guess. We'd be happy to work with you and them. Okay, so it is, what time is it? It is about 11:08. We have time for questions, opening up the lines here, and quiet. Okay. A lot of information.
Well, this is Abby. I'm just going to jump in. I think we've flipped the switch on the coordinator SharePoint site, so your field people should be able to go in there easily. If that's not the case, if somebody could let me know, I sure would appreciate that. But that should make everybody's life a little bit easier now. Also, Dr. McCluskey wasn't able to join us today, but he is going to join us on Thursday morning. And so these are being recorded. We do recognize that not everybody who's on the call today will be on Thursday, so I'm going to have his recording kind of be a standalone recording, and we'll post those to the SharePoint site, and I'll let the coordinators know when that's there. The AT&T folks told us yesterday that it takes about 4 business days to get these recordings, so I don't really see these getting posted until next week sometime. I feel like I had a list of things, and I left it at my desk, so... as always, if you think of something after this call, please reach out to us however you want. We're here for you. And I guess that's all I had. Good.
We'll stay on for a few minutes here, see if there's any questions, see if we've lost a bunch of folks, or they're still going through the manual, or whatever you need. There's a lot to cover here in these surveys. We've anticipated there would be about 1 hour to complete, so please plan accordingly for that.
Hello, can you hear me?
Yep.
Okay, I got a question about, as I look at this, I have some, and based on some of our experience with some previous recent NAHMS, a question goes through my mind about, is there a minimum threshold, do you have a metric on the minimum threshold of respondents that you're going to need by state and nationally for this study to have the power, for the data that's collected to have power or meaning that we're hoping to glean from it? Do we have some threshold ideas there? Because unfortunately, with biosecurity and some other factors, I've seen our participation numbers for NAHMS studies go down. This is less intrusive in some ways because we're not doing actual animal handling and going on premises, but I do have some concerns there. I'm not trying to be pessimistic, but just trying to get an idea.
Well, yeah, this is a very good question, and this is one that we have been grappling with since we, since DS opted to move forward with these surveys. I appreciate that you said that this was less intrusive than a typical NAHMS study where we have to, collect biological samples, and that hopefully the producers will see it as less intrusive if we can meet them someplace off-site, or you as data collectors can do that. So regarding your question about the sample size and power and so forth, we are planning for 30 to 40% response rate. We really, our goal is a 30% response rate from our mass enumerators who are out in the field right now, getting those signed consent forms. Once we get those consents in, I think we will, or as mass gets them in, I should say, we will have to evaluate what our response rate is going to be, and hoping for one that is satisfactory, that we feel that we can get a representative sample. We have the support of producer groups, and in particular for the swine survey, we have the support of the Animal Health Institute. We have folks out there who have been, informing their colleagues and other producers of the value of this and the importance of it. And especially for the stewardship questions, they really do want to get the message out that they're using antibiotics judiciously, and they are good stewards. And so we're hoping that because those questions are in there, that we will have the support, continue to have the support of the producer groups, because they do want to demonstrate that antibiotic use on farms is not solely the problem that of antibiotic resistance. So this is that we are good stewards. But to get to your point about power and sample size, we will have to evaluate that when we get the number of consents in that we have. We never report data at the state level, so that might not be as much a factor. We do report our results at the regional level and the national level. So we're hoping that if we aggregate up to that level, we still will have a reasonable representative sample, and we always compare our sample with the population that we're trying to represent. So we'll see if we have if we're overrepresented in some areas and underrepresented in others. We don't have an absolute cutoff of, say, if we only get 5% or 10% of participants, respondents. If we get something that's very low, I think we'll need to have a discussion about the information that we collect, and go back to our producer groups and talk with them about why we didn't. If pessimistically speaking, if we had a low rate of response, we would need to go back with them and see if we can't find out why, so it would give us at least some information going forward on that. So I know it's a long answer to your question, but it is something we've been thinking about, and I can't say we have a cutoff or decision right now. But thank you for the question. It was important. Okay, it's 11:15. I don't think we're hearing any more questions. I don't know that we need to stay on the line in case people have questions in the future, and they maybe didn't want to bring them up on the call or on the website. We are here. We're in the NAHMS unit. You can get in touch with Abby, look on the SharePoint site. All of our information is available somewhere to you. So please don't hesitate to contact us.
Thanks, Kathy. All right, everybody. Have a great day.
Thanks, everybody.
Tanya, are you on?
Jasmine's with us now.
Oh, Jasmine. Sorry, Jasmine?
Yes, I'm here.
Hi. Do you need anything to bring this to a close?
I do not, actually. I was just going to see if you guys needed anything.
No, I think
No,
we're good.
a drink maybe, but
All right.
Water. Yeah. Okay, thank you.
Don't drink.
Jasmine, thank you for your help, and thanks to Tanya this morning for all of her work setting this up. It took us
All right.
effort.
Yeah, no, not a problem.
Great.
all right, have a great day.
You too.
Okay.
Bye-bye.
Bye-bye.
Bye.